My name is Levy Juma. I work for Youth Alive Kenya as the regional coordinator, where I oversee our programs implementation in Western and Rift regions. In the organization also, I work as a program officer where I coordinate all the projects being implemented in the 12 counties we work in, with Kisumu County being one of them. Youth Alive Kenya is a member of the Kisumu County SRH-UHC Alliance. As an organization, our focus in the Alliance is on works on budget advocacy, where I represent the organization in the budget committee. The Alliance is made up of over 10 organizations working in Kisumu, and through these organizations we've been able to build synergy in the work we do in regards to issues around sexual reproductive health rights and universal health care. And Kisumu County being one of the pilot counties that was implementing UHC, one of our greatest wins has been the engagement we've developed between the county government of Kisumu and the Alliance in the rollout of the UHC. This has also been necessitated by financing of the UHC programs at the different levels within the county. Secondly, we've been able to engage with the members of the Alliance through different capacity engagements. And some of the quicker wins the members have had, they have had improved knowledge on budget processes, and this has greatly improved in their budget advocacy work, where I've been able to influence budgets, with one key example being the increased allocation for SRH from partly 5 million to 60 million in the 2019 budget. Secondly, we've also been able to interact with the County Assembly Budget Committee, who have been crucial in assisting the Alliance in knowing the budget lines, and we've also been able to support the development of Kisumu County costed implementation plan. The other quick win we've had as an Alliance has been the member organization building synergies outside the Alliance, and this can be reflected with the work they do in the respective organizations, not only focused on SRH and UHC, but also other programs that they either implement. Another thing that we've stood out from other organizations or other networks working in Kisumu is that we've increased our visibility and engagement with the various stakeholders, and this has been done through our media advocacy work. We have been able to share what's happening, and this has also enabled some policymakers to take action, with another example being a documentation we did around areas of gender-based violence in Kisumu County, and this has necessitated for actions within the county framework in dealing with the gender-based violence, and also providing safe spaces for the victims or the survivors of this act. In regards to our work around RAMCA, that is reproductive, maternal, child and adolescent health, our focus has been more on maternal and newborn health, issues around child death and adolescent. And one of the glaring statistics within the county has been the increased number of teenage pregnancies. So as a key ask for us as an Alliance is how can we reduce the cases being reported on teen pregnancy. Also, how do we provide systems in regards to response or reporting on the gender-based violence acts that are being reported. Kisumu being one of the counties that has highest number of gender-based violence cases, how do we support the county government in also building up or having safe spaces for the survivors of this act? The other thing would be, how do we work with the county government in regards to health financing? You realize the budget of Kisumu County or the county government of Kisumu Health takes close to 2 billion. So in regards to health financing, how is this spread out across all other departments, not only focusing on specific entities on personal enumerations or remuneration, but on service delivery? Our primary work within the Alliance is based on the advocacy work we do, because advocacy is about influencing policies or priorities within the government frameworks. As an Alliance also, you realize that media is used to advance policy initiatives. So for us as an Alliance, and in regards to the current global pandemic that is COVID-19, we envisage media advocacy to be a critical tool for us, and through this we are not going only to rely on conventional media, that is the local FM stations and the television stations, but also as a network working with a lot of young organizations that is youth-led or youth-serving. Our focus will be how we'll be plugging into the social media platforms, because these are easily accessible platforms used by a lot of young people, and also these young people are our target beneficiaries. So plugging into the social media platforms through developing campaigns regards the areas of where we work it, be it in pregnancy, issues of gender-based violence, issues around reproductive or maternal births. So around those spaces. Thirdly, we also work with other media personalities who have influence or influencers to target the young people, but also we look at what are these appropriate age information that we'll be disseminating to our target beneficiaries. Our role in working with the media as an alliance is to mobilize communities to have their priorities listed down and also implemented as per their needs. And as an alliance, this has been key to us because we've been able to use media to mobilize community members, health practitioners, youth advocates to participate in these forums that are organized by the county government of Kisumu. At the same time, our work with media revolves around giving the correct information. So for us, this is to support of the documenting initiatives that are being done by Alliance, and also to interrogate the gaps that are there, to share with the relevant stakeholders who not only give their word, but they are aware of what's happening, or they don't attend these community meetings. The other bit about us with our focus on media advocacy is to build the capacity of organizations to be able to report the correct and accurate information in regards to the advocacy issues we are focusing on.